Welcome everybody to our session on cold chain management during a pandemic. We've got a great panel of cold chain experts here today, and we'll be delving into a discussion about how the pandemic has impacted the cold chain and vaccine distribution in several countries, as well as some lessons learned and best practice for overcoming the challenges and the unique things that the COVID-19 pandemic has created for our programs. My name is Matt Morio. I'm a Senior Business Analytics Officer with Path, based out of Seattle, Washington, and I'll be the moderator for this section. I'd like to announce our panel and then give them a few moments to introduce themselves. So joining us today is Giselle Iraguha from Rwanda, Yogesh Baramai from India, Christine Laniero from Uganda, and Ernest Some from Kenya. Giselle, I'll let you start with your introduction.
Thank you, Matt. My name is Giselle Iraguha. I work for the Ministry of Health in Rwanda in the immunization program. My current position is the Vaccine Stock Management Senior Officer. My duties, my key activities on that position are the planning and forecasting for vaccine and the supplies and the cold chain equipment for the central level and the lower level. Another key activity is the cold chain management at central level, which include the temperature monitoring. And another point is vaccine management, which include the regular inventories, reporting, and the supervision of the lower level in terms of vaccine management. Thank you.
Thank you so much. Yogesh.
Yeah, thank you, Matt. This is Yogesh Bhamre from India. Actually, I'm associated with National Cold Chain Resource Center and working as a coordinator and team lead. My job profile, my duty is actually revolving around the capacity building of the cold chain technicians and handlers in their respective areas for repair and maintenance and handling, even to develop some training materials like short films and undertaking some assessment and studies and providing the technical supports to Government of India to handling the turnkey solutions regarding the WSC and WF installations and power backup solutions. Also, I have a very interesting mandate of the newer technology integration in the cold chain. So our the center's prime mandate is also one of the testing area, that is the cold chain equipment performance testing. So overall, we are dealing with the technical integrities of the cold chain, and we're supporting Government of India in implementing the immunization program effectively across the country. So this is all about me. Yeah.
Thank you. Christine.
Thank you, Matt. Hello, everyone. I'm called Christine Laniero from Uganda. I work with the Ministry of Health in Uganda, based at the national level. I hold the title of a cold chain technician, and as part of my job duties and responsibilities, I do conduct cold chain preventive and corrective maintenance activities. I participate in monitoring and supervision of district stores and health facilities. We conduct installation of cold chain equipment in the districts and health facilities. As part of my roles and responsibilities is cold chain equipment, and I also participate in the forecasting of annual and periodic vaccine needs for the country, development of training materials for the healthcare workers and the district cold chain technicians. Finally, I do sit on a committee for management of vaccines, where we meet on a monthly basis to discuss issues in relation to cold chain and vaccine management. Thank you.
Thank you. And last but not least, Some.
Thank you, Matt. My name's Ernest Some from Kenya. I'm the current head of cold chain. My duties entail cold chain equipment maintenance, cold chain equipment forecasting, cold chain equipment spare part forecasting, and also development of training materials for cold chain and vaccine management for both health workers and technicians, that is the biomedical engineering technicians. Thank you.
Thank you all.
I'm the current head of cold chain.
Thank you all. So as you all can see, we've got a great panel of experts here today. And what I'd like to do is just start with kind of our first question of what is the current situation in your country with COVID-19, and how has the pandemic impacted your management of the cold chain? And Christine, we'll start with you.
Thank you, Matt. Before I start, I would like to give a brief overview of the supply chain system in Uganda and how it's managed. In Uganda, we manage 3 active levels of the supply chain at the national level, district, and health facility levels. To date, the country has got 135 districts, and each district has got a district vaccine store. This district vaccine store is managed by officers referred to as the district cold chain technicians or assistants. 7 of these newly created districts have not yet established their vaccine stores. And we also have over 5,000 health facilities that deliver vaccination services. We also do conduct vaccine distribution from national to district level. Now, getting back to the issue of the pandemic, currently we are trying to catch up. We are in a phase of catching up with the lost time to see how much we can do to be able to recover our cold chain system specifically. So going back, in March this year, that's when the country actually discovered its first case of COVID-19. And immediately the country declared a total lockdown, which ran from March up to around May 2020. This lockdown greatly restricted movements, and to this effect, a curfew was also put in place. This curfew would begin at 7 p.m. up to 6 a.m. of the following day. So this greatly affected movements. Then we also had a total ban on public transport means, and these are the means of transport that are most used by our health workers and staff. We also had restricted field activities. Remember, we have to continually move down to support activities at the district and health facility levels. These were totally restricted because of this ban. Now, the impact of all these restrictions, what kind of impact did it have? First of all, we had shifted priorities. Most of the priority was now towards COVID-19, especially at the district level, leaving out the other activities. Due to the restrictions in movements, we registered low staff turn-up at the health facilities and in the districts. And these are the people who are responsible for conducting these key cold chain functions and tasks like the preventive maintenance, the temperature monitoring, compiling and submission of periodic reports. And remember, these people they rely so much on internet cafes. Most of them do not have access to computer services, so they do this work in internet cafes. Now the cafes were closed during that period, so this greatly impacted on the reporting rates at the national to the national level. At the national level, we also had challenges with compilation of reports due to the virtual nature of the work that we were doing, and also limited internet accessibility. Now, the low reporting rates greatly affected visibility of the content. This led to increased downtime of equipment. You find that a fridge or any other cold chain equipment may fail at facility X, but because no reports are submitted, it will take us long to get to know, so the equipment ends up being down for long periods of time. There was also reduced opportunities to conduct capacity building at the lower levels, especially for newly recruited staff. We usually have a high turnover of staff, and frequently we go out to build capacity in this staff. So this greatly affected us. And then when it comes to the issue of spare parts, it was a big challenge. Transportation was a problem. Getting spare parts to the points where they are needed was also very, very difficult. This affected us so much. By the time the lockdown was declared, the country had actually just started implementation of CCOP, phase 1, year 2, where the country received a total of 996 cold chain equipment. This was a mix of solar and electric equipment. So due to the lockdown, installation of this equipment had to be put on hold. This greatly affected services at the lower levels, especially for facilities that were expecting to replace, for example, their gas refrigerators that already have very high maintenance charges, maintenance costs because of the frequency of breakdown. These are very old equipment. Some have been in the system for more than 10 years. Then we also have the issue of facilities that are still relying on gas. We have a number of them in Uganda, and getting gas to these facilities became a problem due to the transportation restrictions. So this led to a temporary break in the cold chain in some of the facilities to some extent. Then when it comes to distribution of logistics, it was also a challenge. There were a lot of delays in there, both from the national to the district and also from the district level down to the health facility level. And coming back to the national level also, there were issues with cargo freight. Remember, airports were closed during that time. So getting vaccines into the country was a problem. The time the lockdown was imposed, the country was planning actually to conduct a yellow fever reactive campaign in one of the regions. This had to be put on hold. We had already transported the vaccines, were in country. Storage space was a challenge. So the yellow fever vaccines had to be stored for quite a longer period of time than we expected. And then finally, coming back to these virtual ways of doing work of late, it's very, very expensive, and it takes a big toll on everyone in the program. Yeah, thank you.
Thank you so much, Christine. That's a lot of challenges, and now we can hear from Giselle on how Rwanda has been impacted as well.
Thanks, Matt. Thanks, everyone. I would like to give you the background of the cold chain in Rwanda. We have 3 tiers of cold chain. First, we have the central level, which is the national, which is at EPI, National Central Vaccine Store. At that level, we have 9 cold rooms, which are positive, between 2 to 8 degrees, plus one freezer room, which can go up to minus 25 degrees. And another level, the second level we have, it is the district level, where we have 42 district hospitals, and each one is equipped with cold chain equipment. And the third tier is the health center, and we have 507 health centers countrywide, and each health center has a cold chain equipment. So back to the management of the COVID-19 and its impact on the cold chain in Rwanda. There was no much impact or significant impact of COVID-19 on the cold chain in Rwanda, because in Rwanda, we are during a total lockdown, health workers were allowed to move. They got official authorization to move from the central level to the health centers. So with those authorization, activities have continued as planned, including the supervision and the maintenance of cold chain equipment, either from the central level, the district level, and the health centers. In addition to that, we have a remote temperature monitoring at central level, which has helped much, because people, wherever they are, they can monitor how the cold chain equipment at central level are performing. And at district hospitals and health centers, they have fridge tags, which capture the temperature of the cold chain equipment, and the health workers can assess the performance of the cold chain equipment from the reports of those fridge tags. In addition to that, At a central level, we have a biomedical engineer who is looking after the cold chain equipment we have and its maintenance on daily basis. And at the district hospitals, each district hospital has a biomedical engineer who is trained on cold chain management and maintenance. And that biomedical engineer is supervising the health centers in his or her catchment area. This has really helped during the lockdown, where other movements were restricted except for the health workers. These biomedical engineers were going to the lower level, meaning the health centers, and they could manage or perform the maintenance of the cold chain equipment who had failed or who had have the problems. In addition to that, in Rwanda, we have a strong internet connection at every level. And this has helped us very much, where we didn't have interrupted communication between the levels, and the reports were given timely without interruption. The only challenge we had was the implementation of the CCOP project, where we had the delay in the receiving the cold chain equipment who were on the way. They were not received in the country timely. And after that, when they reached the country, as the other movements were restricted, the installation has also delayed. It has delayed for 2 months. The installation started 2 months just after the lockdown relief. That was the main challenge regarding the cold chain equipment and management in Rwanda. Thank you.
Thank you so much. And next, Some, let's share a little bit of what's going on in Kenya.
Thank you, Matt. The pandemic in my country called for the imposition of a lockdown and a curfew. The lockdown was majorly in the major cities of Kenya, that is Nairobi, which is basically the headquarters of the country of all the ministries, including the Ministry of Health and even the Central Vaccine Store, which is a program under the Ministry of Health. The curfew limited movement between, we had curfew in the whole of the country, which started from 7 p.m. to 5 a.m. in the morning. This impacted in the sense that it limited operation time, resulting to fear of venturing out of designated stations. People would not want to go outside the designated stations. There was also a decrease in distribution of spare parts to counties. There was also the deployment of technical staff to pandemic-related assignments. There was also prolonged downtime due to limited time for technical staff to attend to broken down equipment. There was also suspension of planned trainings, yes, because during that time, everything was put on hold. Everything was put on hold. So in that case, planned trainings related also to maintenance aspects of cold chain were also suspended. Basically, that's how the pandemic affected the cold chain situation in Kenya. Thank you, Matt.
Thank you so much. And finally, Yogesh, if you can share a little bit about what's going on in India, please. Still muted.
Hello. Am I audible? Okay, great. As you all might be knowing that India has the largest immunization program in the world. Okay. So our annual target is 26 million children and 30 million pregnant women. So having a very wide infrastructure of cold chain equipment from national level up to primary health center level, actually it includes the active cold chain equipments like walk-in cooler, walk-in freezer, ice line refrigerator, deep freezer, and solar refrigerator, and also with the passive cold chain devices like cold box and vaccine carrier. Even recently, Government of India also introduced the feeder vehicle in the cold chain. Okay, so India has very great system of actually maintaining this cold chain, as because there are planned preventive maintenance in plan. Every district has got a district cold chain technician, so every maintenance is in-house in India. So taken care by the district cold chain technician at every place. So impact of this pandemic is actually the schedule on this planned preventive maintenance. Whether the actually our schedule was quarterly and semi-annually like that, but because of this pandemic and this restricted movement of the people and this lockdown scenario, definitely there is impact on the PPM schedule. Definitely there is impact on this supportive supervision timetables and all these things. But still India made the efforts actually to manage the things very successfully because of in our infrastructure there are the real-time monitoring devices are there like data loggers under the electronics vaccine intelligence network. Again, we're also having a very uh, good software of National Cold Chain MIS, in which actually we are capturing the real-time data information of the complete equipment status, whether it's actually from starting from the functional, non-functional, under repair, like that, everything. So we're capturing the daily work done and everything in the software. So in this case, actually, only the thing is people could not manage to update the data regular interval because visits are not there. But still, uh, anyhow, India is managing all this actually the management through this real-time information and analyzing the data. One another thing is the capacity building, as actually our center is very large instrumental in this capacity building area. But capacity building definitely the schedule and timetable hampered because of this pandemic. And at some places, not everywhere, but at some places where the constructions of these vaccine stores were going on, and somewhere the procurement of the spare part and this equipments were going on. That is also got hampered, but not hampered actually got delayed because of this all this pandemic scenario. So this is all about, but actually we are the loss is repairable and we are recovering from this all whatever the impact we actually faced during this pandemic. Yeah, this is all about the India scenario. Yeah, in our country.
Great. Thank you everyone so much. I mean, I think we can all see that there's a lot of common challenges and some unique ones as well across everybody's different experiences here. And I'd like to ask you guys now, kind of, what have you done to address some of these challenges and manage the cold chain equipment and vaccine distribution, given the situation you've kind of described. And Some we'll start with you.
Yeah, actually, see,
You guys are gonna start with Some.
yeah. Uh, okay, fine. Okay, so just I'm explaining the how we address this challenge actually, because see, for the capacity building, we will develop some virtual training programs for all our technicians and even for the handlers also. We conducted some virtual training programs, so we started continuing the capacity building exercise even for the maintenance perspective if you talk about. So technicians were instructed actually, and the handlers also, because they used to do very proper evaluation and proper diagnosis of the equipment. And if there is a need only, then only the handlers or the users will call the technicians, and then only he will visit that facility. And in a one go, he will undertake the minor repair also in preventive maintenance also. And as the public transportation was totally stopped during this lockdown, so technicians managed with their own vehicles and all. And but the thing is only if the PPM is scheduled for 15 days or 20 days, then it is just minimized for 5 days or 6 days per month like that. But anyhow, the strategy was actually if major repairs is there, then just go and replace the equipment, and major repair you undertake at the workshop places like that. And before going to the repair, just analyze the fault while with talking with the handlers. Just analyze the fault by monitoring this data loggers and all. Just analyze the fault with analyzing the data with this MIS. So this strategy has been developed, and the technicians and handlers were instructed, and they are doing it very nicely. Yeah. Yeah.
That's great. Yeah, sounds like a lot of coordination and communication needs.
Yeah.
Some, what is going on in Kenya?
Okay, for Kenya, how did we address these challenges related to the pandemic, the COVID pandemic? We had, let us first of all look at the structure of maintenance, of cold chain maintenance in Kenya. at the central level, where we have the central vaccine store under the National Vaccines Administration Program, we have 4 biomedical engineers whose responsibility is cold chain maintenance. Now, we have the central vaccine store at the national, but we also have 9 sub-national stores whose maintenance responsibility falls under the national. Now, from the sub-national level, our lowest distribution points, which are the sub-counties, 291 sub-counties tend to collect the vaccines from the sub-national level. So the purpose of the sub-national level is to be able to move the logistics closer to the counties so that their sub-counties can be able to collect the vaccines and other commodities from those points instead of coming to the national. Now, within those counties, we have biomedical engineers whose responsibility is to carry out maintenance of cold chain equipment within their sub-counties. Okay, so you find that in case of breakdown, the national officers or the national cold chain officers do not have to go down to the sub-counties to repair the equipment. Another thing is that how were we maintaining the cold chain at our sub-national levels, which are our responsibility to maintain? We have biomedical engineers within those counties where we hold the sub-national depots that we've trained on cold chain and how to maintain the cold rooms, because at that level we have cold rooms and we also have generators. So they are quite good in repairing of the cold room. So they are usually our first call. In case of a breakdown, they're the first ones to respond to a maintenance issue within the subnational before we are called in to come and fix. In case they're not able to fix at that level, then that's when they communicate to us and tell us there's an issue and they're not able to fix, and that's when we go. Now, at that low level, so we have biomedical, we have staff. So much as we had a lockdown, the staff are already down there in those facilities. So they're able to actually carry out the maintenance. Now, another way we managed to address this challenge is that we had a very good data visibility of the cold chain situation down there. Yes, we were able to visualize how the cold chain equipment are performing. And when in case of issues, we are also able to see that there's a problem somewhere that needs addressing. And again, we're able to find out if in case the problem is not tackled fast. So we had to rely on the data that we get from our cold chain dashboards to be able to see how the equipment are faring on. Another thing is that we also had virtual meetings. We also were relying mostly on healthcare workers to perform routine tasks related to maintenance. Yes, recording of temperature, ensuring cleaning of equipment, ensuring drainage of condensate, and those kind of tasks. And we have standard operating procedure booklets that we've supplied to all our service delivery points. So the health workers, the technicians actually know what they're supposed to be doing as their daily tasks, as their weekly tasks, and that continued. Again, we were communicating with the county technical staff through the mobile phones and also through Zoom meetings where we are able to discuss issues related to maintenance. And basically that's how we were able to address the challenge caused by the pandemic.
Thank you so much. Yeah, I'm sensing a theme here around data and communication. So Giselle, can you share how you guys have been managing things?
Thank you, Matt. In Rwanda, as mentioned earlier, we didn't have much challenges because we have facilities. For example, we had facilities of transportation for healthcare workers during the COVID-19 lockdown. This is from central level to the health center levels. In district hospitals, the immunization program in district hospitals has got a pickup vehicle for the supervision and the follow-up of immunization activities in the catchment area, and that includes also the maintenance. So biomedical engineers from the district were enabled to go to the health centers to support in wherever needed in maintenance. In addition to that, health centers have been equipped with the motorcycles. All the health centers have the motorcycles. They were able to move from the health center to pick vaccines and to go to the outreach sessions and to follow up the immunization activities in that area. Another point is the strong communication between the levels. As I have said, we have internet communication facilities in each health facility, which has helped in the reporting system. And wherever needed, each level was seeing the report from the lower level, for example, at the central level where the spare parts are needed, and we were able to manage or to send the spare parts for repair for those cold chain equipment. The only challenge was the implementation of the CCOP. As I have said, we had 2 months of delay for CCOP implementation, but after the total lockdown, we had started the implementation. Therefore, 437 cold chain equipments are now installed in the planned health facilities, but that is for the batch for the first year, and the second year is under the procurement process at the supply division in the UNICEF. So that is how we are managing the challenge of cold chain equipment optimization platform implementation in Rwanda. That's all. Thank you.
Thank you so much. And now, Christine, how's Uganda been managing?
Thank you, Matt. Now, in Uganda's case, the lockdown definitely had a lot of impact. And on realization of this tremendous setback, the Ministry of Health, together with the development partners, sat down and developed guidelines, developed and disseminated guidelines for continuity of essential services. So these essential services, of course, included health and immunization at that. And this guideline mostly emphasized the need for health workers to follow the standard operating procedures while they go on with their routine duties and activities. We also had a meeting at the national level, that is the committee that sits monthly. We held an EPI supply chain resiliency planning meeting. So during this meeting, a number of interventions were put in place to mitigate most of those challenges, like the stockouts, like the availability of spare parts, and all the other related supplies. So this gave us a clear picture or roadmap of how to move amidst the COVID-19 situation. We also had to approve through the Permanent Secretary, Ministry of Health, we approved a supplementary funding to support a catch-up kind of activity to be able to catch up with the lost time. So this supported cold chain activities as well. It supported mobilization for immunization activities and additional outreach posts. Upon developing these guidelines, the CCOP project actually had to continue. We had a letter signed, drafted and signed by the Permanent Secretary that gave a go-ahead to the teams to go on with the installations. So the project managed to take place, and as I speak, we are nearing completion of installation of the 996 equipment. This has helped to bridge the gaps of especially equipment that are still reliant on gas, those solar battery powered that were already broken down, at least we had a clear way to go. The government also worked on provision of personal protective gears to the health workers, and this included the cold chain personnel as well. We had provision of masks, nose masks or face masks, then hand sanitizers and hand washing facilities. This gave confidence to the health workers and the personnel at the lower levels to be able to continue with the delivering services amidst all the challenges of COVID-19. Yeah, in brief, that is basically the strategy we've used. Thank you.
Thank you so much. Yeah, this is very interesting and great to hear how you guys have all worked through some of the challenges, some common themes of data and visibility and being able to respond to that. And the PPE and sanitation station kind of leads me to my next kind of follow-up question for Yogesh is, if you could share some thoughts or best practices related to risk mitigation, considering the cold chain maintenance and especially with the COVID-19 and the unique nature of this virus.
Thanks, Matt. Actually, the best practices it covers for the workplace safety exactly which require. When we talk about the workplace safety, okay. So generally, as far as the cold chain equipments are concerned, and especially the cold rooms and freezer rooms, the hazards like freezing injuries and frostbite, even the hypothermia. So we treat this as a hazards, okay. And when we talk about the safeties, so when we are actually while undertaking the repairs, when we are playing with this refrigerants and nitrogen and again the electricity, so these are we require to be taken care of. So these are the safety and hazards. They are associated with these kind of practices. They are forever, okay, and we have to take care about that. But now the addition is this COVID-19. The unforeseen circumstances are there because of this COVID-19 pandemic. But many times and most of the times at many places actually the technicians ignore regarding the safeties and hazards. But now this will not be actually accepted because the COVID-19 is a deadly pandemic scenario. So now compulsorily for technicians wearing a mask or to washing the hands after each activity, or even to sanitize their tools and tackles if they are actually the operators in walk-in freezer, so sanitize their or disinfect their freezer jackets and gloves and hats like that. So this is very necessary right now. And when I talk about the operational perspective of this cold chain equipment, so ventilation is a very main aspect in this regard, because you need to have a very clean environment, very hygienic environment if you thought about the virus, because studies are not revealed right now how much time, how long the virus will survive in this cold environment, okay. So this is actually the area where we need to look after to keep ventilation, or if ventilation, natural ventilation not there, then to have some forced ventilation, intake of fresh air should be more, okay. So such kind of the good practices and best practices, this is a need of an hour to bring out for this all this activity in our operations, in daily operations, because not only actually the safety and hazards for this equipment, but this corona has brought some risks actually, and that is a very serious risk for our human beings. So we have to be very careful about, even if you talk about the passive cold chain while handling this cold boxes and vaccine carrier. Generally we used to wash this with a simple water when it is not contaminated, but now contamination chances are there, so we have to use some sodium hypochlorite and with the appropriate guideline of that EPA. So we have to be careful about this, all the workplace safety, and the country has to develop some SOPs. Country need to develop some guidelines regarding this, to how to work under such a you can say a very risky environment, because unless and until vaccine not being introduced for this COVID-19, we will treat this environment, even the working place, very risky for all of, whether the technicians, whether the handler or anybody who is actually visiting these vaccine stores. So risk is there. So better to have workplace safety in mind and to go with all the safety measures in our hand. So this is all about my thoughts for this cold chain equipment management or the workplace safety concern. Yeah.
Thank you, Yogesh. Yeah, those are some great considerations, especially even things like the vaccine carriers and um, distributing the vaccine. And I guess considering vaccine distribution and availability within Rwanda, Giselle, how has the country managed some of those challenges?
Thank you, Matt. In Rwanda, there has no disruption or stock out of vaccines countrywide because at central level, we have refrigerated trucks which are distributing vaccines in every district vaccine stock. And from the district, each hospital has a pickup, which, as I said, which facilitate the immunization activities. But the health centers, through the pool system, they collect vaccines from district vaccine store. And in that line, health centers were authorized to move using their motorcycles for the immunization program to pull or to collect vaccines from the district vaccine store. That's how it was conducted. Therefore, vaccine distribution and immunization activities have continued and in a smooth way. That's a Rwandan experience during this COVID-19. Thank you.
Thank you. Yeah, that's great to hear that the provisions and waivers were granted so the operations were able to continue. Summit, could you please share how Kenya has used data and remote temperature data to better manage the equipment, kind of as you mentioned, in repairs as well?
Thank you, Matt. How ways in which we manage ways in which we manage the field repairs and maintenance of cold chain equipment in the field. One, I think it's good to understand how the maintenance system works. When there is a breakdown of equipment in a service delivery point, what normally happens is that the user has a job aid first, which shows a job aid that shows diagnosis of the problem and what needs to be done. So the users are able actually to define the problem and be able to see whether they're able to fix the problem. So it's actually a diagnosis of the problem that they're experiencing at that point in time. So the user sees whether they're able to fix the problem. If they're not able to fix the problem, then they escalate the problem, they report that to the engineer. They can either report to the engineer or their immediate supervisor, who happens to be the sub-county public health nurse. So once it's reported to the sub-county public health nurse, the sub-county public health nurse informs the maintenance officer, who's the biomedical engineer, to be able to go and repair that equipment. Yes, we had a lockdown, but the lockdown was only in the capital cities. It was not down there. So they were able to freely move around within their respective counties. We've equipped the biomedical engineers with motorbikes. So all the 47 counties have a motorbike for EPI support. And we've also equipped them with refrigeration toolboxes. So they have a motorbike and they also have refrigeration toolboxes. So they're able to actually properly go out and repair the equipment. Now, at the up level, at the supervisor level, either the sub-county supervisor or the county supervisor or us at the national supervisors, we had very clear data visibility of the cold chain situation down. One was through various dashboard. One is the POGO dashboard. Another one was through the B Medical Systems dashboard. Another one was also through the NextLeaf CT5 dashboard. So we had this, somebody would ask, how are we using the NextLeaf dashboard? We have the CT5's Coltrace 5 that we've installed in all our 291 sub-county depots. So all our lowest distribution points have an RTM. So we were able to log in and be able to see the functioning of all our lowest distribution points. B medical equipment from B medical systems all have RTMs, the ones that we have, the ones that we procure through CCOP, and the ones that we also did a major procurement through World Bank, all have an RTM device inbuilt, so, or installed together with the refrigerator. So we were able to also log into the B medical systems dashboard. Now, for the equipment that did not have the RTMs, FT2, which is a 30-day temperature recorder, is a device that you'll get in each facility in the country. Each service delivery point has an FT2E gadget, which is a 30-day temperature recorder. Now, periodically, the health workers would upload data using an app called Varo, which is in their phones. So they would upload data from the FT2Es periodically, and we would be able to visualize this data on a Pogo dashboard. A Pogo dashboard is a dashboard that we use to visualize FT2 data from all the facilities in the country. And there's a particular model of refrigerator called the ACMA CFD50, which is channeled, which its data is also channeled to the Pogo dashboard, and we're also able to visualize the RTM from this particular refrigerator on our Pogo dashboard. So we had very clear data visibility. So in case of breakdowns down there, in case the breakdowns takes too long and we see that an equipment has not been worked on, then we would be able to call in and find out what are the challenges there. Another thing is that the equipment that we installed, the CCOP phase 1, together with the equipment we bought under World Bank, they were still under warranty, you know? So we had agents from B Medical, and we also had agents for Vestfrost, whose responsibility was to attend to equipment that still were under warranty. And the way we would allow them to move, yes, during the lockdown and during the curfew, they were the essential service, much as they said essential services would still go on, that did not mean that you as a health worker would be able to freely move out of a lockdown area and go to another area. You still needed a clearance in the form of a letter. Where are you going? What are you going to do? Yes, essential services were ongoing, but that did not mean, because people would have actually misused, you know, essential services to move around, you know, like going to visit friends and that kind of thing. So to prevent that, yes, essential services were must, that they must continue, but you needed to have another letter that says where you're going and what are you going to do. We managed to give equipment agents for Vestfrost and for B Medical System exemption letters to allow them to go and attend to these equipment that were broken down and were still under warranty. So that is how we managed to manage the issue of repairs and maintenance during this pandemic. Thank you, Matt.
Thank you so much. Yeah, it's great to hear all these challenges overcome with technology that's been available, but probably not necessarily used as much as now, that it's kind of forcing us to look at RTM and things like that more than before. Christine, has Uganda used any other tools or things to help understand cold chain status during the pandemic?
Right. Thank you, Matt. Thank you, everyone. Now, as I stated initially, we had a lot of challenges during the lockdown, especially as regards visibility of the status of cold chain equipment at the lower levels. So during this very period, we were actually undergoing a study. This study was courtesy of Path Uganda, using the ODKX application. This application, we use it to update our cold chain inventory, and it does much more than just update the cold chain inventory. So during the lockdown, as we were having challenges with visibility, we realized that 3 particular districts where this study was ongoing, their data kept coming in. You know, we could access information from these districts on the ODKX platform. we would always get to know how their equipment are performing. So this gave us a learning point that actually, if we have the ODKX application in place, we would have a better visibility in this kind of situation, and it would give us a better plan on what we should do to be able to mitigate the challenges we are having. Now, the ODKX, as I was saying, it also submits the data at a lower cost compared to somebody going to an internet cafe. So that's another plus for the ODKX. It also gives information of any repairs that or maintenance works that have been conducted by either the district cold chain technicians or any other person from the national level who could have gone down to do any repair works. We can be able to know what this person has done, what kind of spare is either needed or he has been able to use. So you can easily document the maintenance and repair works. This also aids in accountability, especially for the user to be really a very, very good tool. Besides all that, we also get from one point to the other.
Thanks, Christine. Sounds like the internet's breaking up a little bit, but it's probably worth noting that some of your colleagues will be presenting about ODKX in a different session also. So even though the internet hasn't been that great, the Uganda team will be sharing a little bit, as well as Some will be sharing a little bit more in a different session, so please be sure to check on that. I think we're getting close to our time, so we'll leave some for questions and answers from the audience, but also if there's any just kind of last minute comments from our panel, I just want to thank you all so much for your participation and sharing. This has been great. And we'll start. Giselle, any last comments?
Yeah, Giselle, actually I'm really very happy how even Rwanda, Uganda, all the countries are managing this cold chain, and what some told how the strategies for the managing the cold chain very smoothly, even though the pandemic situation there. Really great, really very great experience, because even India too have a very great plan for this management. Like we are adopting national cold chain MIS and vaccine integration network and the Android apps for the preventive maintenance and supportive supervision and all these things. So IoT based solution means our approach is also very close to IoT based solutions. When we started it, we think that this is a newer technology, how it will work. But now the time has come to adopt this technology because of this remote monitoring and the very accurate data analysis and the action depend on this analyzed data. So it is very, very important, and I'm very happy to see that all these countries like India, even all Rwanda, Uganda, and the Kenya, all countries are the approach is very similar. Like the issues are same, even actions initiated by the country, everything is same. So besides to this, the message is actually we have to be very proactive to manage this cold chain, even beyond this, actually, even beyond this, because technologies are there, definitely technologies are there, which we can deploy and which we can utilize very efficient manner. So the message is actually to move towards the IoT based solutions, and because that will be very useful in this kind of restricted movement scenario. So really, really great experience from this country's exercises for this pandemic situation. Yeah, great experience. Really.
Thank you, Yogesh. Giselle.
Yeah, thank you, Matt. Thank you, everyone. I thank our government in the first line because the improved technology has helped us to manage the cold chain during this COVID-19 pandemic, when all the levels are connected and timely correction measures are made through the effective and strong communication, and also the strong leadership and effective coordination through the social cluster ministries, where they worked hand in hand to ensure tremendously the daily and activities which have to be done are done neatly. Also, there are another point to highlight where we didn't have any stock out at any level, or through the effective vaccine distribution, which was done smoothly. And lastly, I thank healthcare workers for their commitment, and they continued to do their daily work even though there was a COVID-19 restriction, but also the prevention measures helped us to continue the vaccination activities at all levels. And this is the success also to the vaccine supply chain during this COVID-19 pandemic. Thank you.
Thank you. Yeah, very big thank you to all the healthcare workers and all of you as well. Christine, any last comments?
Yes, Matt, thank you so much. Please allow me finish up one point that I had left in the previous session. I just wanted to say that in addition to the ODKX application, which is going to help by giving visibility to the status of CCE, we also have our current CCOP phase. The equipment actually came with 2 temperature monitoring devices, the FT2E and the RTMD. So this, I believe, upon completion of installation, is also going to help us more by giving us even better visibility. And if all goes well, we expect to see this RTMD technology actually rolled out to all our existing equipment. The lessons that we have learned, first and foremost, is partner support, which has been very, very key in implementation of activities, especially during the COVID-19 era. When an established system is in place and we revisit the operational guidelines, it also of essential services. Working with Unicent agent, they have made it possible for us to be able to get supplies in the country in time at such a critical moment. So this has been very good. And then reliability of transport, especially at the district levels, where we have provided vehicles. Almost all our district health offices are equipped with vehicles. The district cold chain technicians have motorcycles for mobility. So this has helped a lot in ensuring services reach to the last point. And then having a distribution schedule in place, this is also very good. It has helped a lot in ensuring that supplies reach the intended beneficiaries in a timely manner. Otherwise, thank you so much.
Thank you, Christine. That's great, and I'm sorry that to cut you off at the end of the internet. And last, Salve, any closing words for our session?
Well, the closing words for the session are basically data, and data visibility. So our biggest challenge had always been, yes, we want the RTMs. One advice I would want to give equipment manufacturers at this age and time is that each refrigerator manufacturer should at least put in sensors, temperature sensors, ambient sensor, internal temperature sensor, maybe probably door sensor. Each equipment manufacturer should be able to do that as standard, okay? Another thing that I would request is that the guys in charge with pre-qualification of equipment to ensure that these sensors come with standard ports so that you can use any RTM from any manufacturer on any equipment that you want, so that it makes your work easy as a user to be able to visualize data using a dashboard of your preference. And again, data enables us to be able to react, to be able to be proactive in maintenance than reactive. Yes, thank you.
Thank you so much. I want to thank all of the panelists, Gisela, Christine, Yogesh, and Salve for sharing so much rich information and experiences from your countries. If we have some time for some Q&A, we'll leave that open for now. But I think that themes, the big takeaways is strong communication all the way from the national level down to the lower levels, and the data visibility, any ways we can enable that and make sure that the data is flowing both up to the national level, but also back down to the people who need it, and getting the healthcare workers and all of you a big thank you and just much appreciation for all you guys are doing, and everybody out there, stay safe. Thank you for the session, and please, participate in some of the other sessions. I know we have some other presentations going, but thank you so much, everybody.
Thank you.
Thank you.
Thank you. Thank you all.